I'm Marco Falcone and I'm the chair of the ESCMID study group for infections in the elderly. Our group is a multidisciplinary group that includes infectious disease, geriatrician, internal medicine, microbiologists, pharmacologists. We think that a teamwork is needed to better investigate and understand infections in the elderly.
The infection in the elderly represents a clinical challenge in our practice. First, because the patient show a lower immunologic response, and then they are frail, and they are frail because of many comorbidities, and they have drug-drug interaction because of the treatment of comorbidities, and they often show a readmission to hospital, exposing them to nosocomial pathogens.
Life expectancy is rising. Soon, more people will become long-term care facility residents exposed to healthcare-associated infections.
Infectiologists are great to diagnose, decide the best treatments in simple but also in complex situations. They help everywhere to plan treatment for common and also rare infections. Aging population in some aspects are complex, have numerous comorbidities and aging organs that react really differently with unspecific clinical signs and many complications.
With our group, we aim to develop international collaborations on research projects on infections in the elderly populations. These are some of our ongoing projects. We work on pharmacokinetics of new antibiotics in elderly patients with resistant gram-negative bacterial infections. We also work on the inflammatory markers predicting mortality in elderly patients infected with COVID-19, and we did a survey on the treatment of hospitalized patients with COVID-19 during the two first waves of the pandemic.
Antimicrobial stewardship programs are urgently needed in the elderly population, requiring an effective infection surveillance, prevention and control programs. The appropriate antibiotic use is quite different from adults and should be tailored. Many items should be considered to optimize antibiotic therapy. Firstly, the local epidemiology different in hospital settings, long-term care facilities and at home.
Randomized controlled trials assessing new treatments for corona included patients 20 years younger than those treated in clinical practice on average. We lack evidence on management of the most vulnerable patients.
I'm a young member of the ESGIE group. I subscribe to the ESGIE because it's a great opportunity for me and for young medical doctors to participate in clinical studies, research activities, and several projects in the field of infectious disease in the elderly.